Hey guys, Dr. Todd Riddle. We're over here at Gateway Chiropractic Studios, and I wanted to talk a little bit about scars today. And we happen to have a good one here. A little bit of the backstory is my wife was helping me hang hurricane shutters before the last hurricane that threatened Houston. And hurricane shutters, if you don't know, they're basically boards that you could push onto your window coverings, and these little clips are kind of what dig into the brick and hang it in. Well, this time it actually dug into Jessica's arm, and any of you that know anything about the anatomy of this part of the arm, she's actually very lucky to have feeling and function in her arm simply because of the nerves and the vasculature that run through that area. But I wanted to just kind of briefly talk about scars because I know a lot of practitioners work around them. I think sometimes they're a little bit afraid to work on them, and it's actually a good thing that patients can do from home as well. So first things we need to kind of talk about is when it's appropriate to actually work on a scar. Generally speaking, obviously the sutures need to be removed. Any scabbing that would be associated with the scar needs to go away. You don't want to peel the scabs off and then start working on it. That could cause the scar to prematurely reopen. Other things we can do to kind of make this a little bit of an easier process is take into consideration the healing phase. So this scar actually will take about a full year to fully heal and kind of close up from the inside as well. But there are three phases the scar is going to go through. The first one's going to be the inflammatory phase, where sutures are generally still in. This thing is going to be red, possibly swollen, inflamed, and quite tender. The next phase it's going to go through is the proliferative phase, and that's where this thing will actually start to pull in some more of the collagen and actually form the scar tissue that's going to bond and kind of hold this thing together. And then finally there's the remodeling phase, and that's really where this thing becomes more like hard concrete, if you will. And when the collagen lays down, it actually realigns itself in kind of a cross-hatch pattern to give it more strength. So generally what we see is the scar itself is not very movable, but the tissue around it can sometimes be movable, and that actually places in a little bit of risk, that tissue around that area. So a couple of before I work on a scar is just kind of check the directionality of the skin. So I'll give it a little pull to see if there's any direction that the scar doesn't necessarily want to move, or if it causes her any extra sensitivity when I pull in one of those directions. And then I'll test this way too. And what you're going to see here is the scar actually does not move well in this direction, but when I pull it down here, it actually moves quite well. I would want to focus a little bit of my attention on trying to get this scar to move a little bit more in this kind of towards the middle of the wrist, if you will. Now, when we're working on fresh scars, so this one happened about 3 months ago, and she's actually still quite protective of it. It does still have some sensitivity associated with it. Obviously some pain. It does get to itching sometimes, and what we can see here is that it's actually developed a little bit of a keloid, if you will, so that's kind of a raised red scar, and to get this to go away would be a very difficult thing to do. I'm just going to go out there and say this scar is likely never going to go away, but what we can do is kind of help this thing remodel further since it's so new and kind of so fresh in its healing phase, so that we can try to give her a little bit less tension in that area, take down some of the hypersensitivity that she's experiencing, so that this can actually kind of soften up, and maybe we can decrease the height of that a little bit. So generally what I like to do is take a little bit of cream, and in this instance I'm using our China Gel Factor RX cream, and I just put a little bit of the emollient onto the skin. Again, this has been closed up now for quite a while, and I start kind of away from the scar just to give her a little bit of chance to get used to having the instrument on her skin. And what I'll basically do is, so remember we had a little bit of a lack of range of motion in this direction, or pull in the skin. So basically what I'll do is kind of get in here, and I'll just kind of work lightly the skin away from the scar in the direction where I noticed that there was a little bit extra tension in the skin. Okay, recommendations for doing this kind of work on or around a scar are generally for about 10 minutes in the various areas of the scar, and they can do this up to 3 times a day. There's a lot of recommendations about things that you can use to kind of help soften up the scar. A lot of people recommend vitamin E oil. There's a lot of other oils, grapeseed oil. In this instance, again, we're using our Factor RX emollient. I like that because it does kind of help a little bit with some of the pain that may be experienced with this. So I'm going to come up, actually, I'm going to switch hands here so we can see, and I'm just going to kind of go around that scar. I'm keeping it light, trying to keep it to her tolerance. And then eventually what we can do is get in here and work on the scar itself. So again, I'm working around the scar. Now, so I don't know if you can notice here, but there's a little bit of swelling that's been pretty persistent throughout the healing process here. So what I can do is actually do a sweep stroke with my instrument to kind of push that swelling up back towards the thorax there. And I'm just going to try to hold the instrument so you can see what we're working on here. Just a very light sweep stroke, just kind of very slow. And I'm, again, pressing to her tolerance there, not pressing into the scar, still just working around that. And I can actually just press some of that swelling back up towards the thorax to get that to clear out. Now, when it comes to working on the scar itself, again, these can be very tender, and I know for a fact it is for Jessica. So when I get in here and start working on the scar, it's just kind of very light back and forth. A lot of times when it comes to using the instruments on the scars themselves, it's less initially about trying to get that scar to soften up and more about the scar just kind of getting used to having something working on it to kind of desensitize the scar itself. So what I'm doing is basically just kind of doing a strum stroke, if you will, across the scar there, trying to keep it light to her tolerance. Usually I say to patients, I don't want this to go any higher than about a 5 out of 10 on our 0 out of 10 scale, with 0 being no pain at all. Once I'm done going back and forth, I can actually add a little bit of extra motion into it just by doing simple little circles. And again, the circles are kind of multi-directional and kind of helps it to soften up in a variety of different directions, because remember we talked about that scar tissue kind of forming in a crosshatch pattern. Now she's going to be able to do this stuff at home simply by taking a finger or 2 fingers and just kind of working back and forth on that scar, doing circular motions as well. Now as far as the length of time that she'll be doing this, again we mentioned she'll be doing this about 3 times a day for about 10 minutes each. But as far as the longevity of it, it would be perfectly appropriate for her to be doing this up to 6 months after the initial injury. Since she's getting a little bit of a late start on it, she could still be doing it for 6 months. To go beyond 6 months isn't going to cause more injury, but again, it's going to take about a year for this thing to fully heal up, so she could very easily push up to a year on this. But that's a basic breakdown of how to deal with a scar. It's important to take into consideration these things because they are significant pain generators, but also because of the change in the fascial tension of the area here, we may start to see some symptoms downstream or even upstream from the scar that oftentimes we don't consider as actually coming from the scar. So just a little update there. I hope this is helpful for both patients and practitioners.